Hello students, welcome to today's session. Today we are going to talk about a very interesting topic of health psychology, which is personality and illness. The main objectives in this lesson are to basically understand the relation between personality and the illness, why personality is important to disease and how specific traits of personality influence our health. Now, one of the oldest and most puzzling questions in the field of health is why some people become sick while other seemingly similar people remain well or quickly recover from a disease. And why do some people live long while others die young? Do the answers lie primarily in chance exposure to pathogens and other threats, or are there any individual factors? Especially psychological matters are of main importance here. Is it true that worries develop ulcers and suffer heart attacks? Is relaxation a technique which helps us to betterment of our health? And keeping a smile on your face make you live longer? The relationship among individual differences, disease and health have been investigated scientifically for more than 100 years now. The general verdict is that a person who is chronically irritated, depressed or hostile, who is unstable and lonely or powerless is indeed more likely to develop illnesses and die prematurely than someone who is generally emotionally balanced and effective, who have a satisfying job and engage with his life, who also has a stable and supportive social relationships and is well integrated into the community. Traditional approaches to health are dominated biomedical model of disease, in which health care is seen primarily as a curing or a repair system needed when medical problems strike. It emphasizes physiology, pathology, procedures and pharmaceuticals. Although it is well known that biopsychosocial factors influence whether an individual will stay well, the dominant biomedical model of disease exerts constant pressure to focus either on internal genetics or on the external threats of infectious agents and toxins. In contrast, consideration of the individual and his or her personality forces are broader and deeper analysis, which is closer to true complexity of illness and well-being. This topic is subject of today's module. Let us first start with historical context. The idea of links between personality and health dates back thousands of years and clearly appears in the writings of Hippocrates, Galen and their followers. The ancient Greeks, who were keen observers of human condition, basically saw four essential so-called bodily humors as very important to both personality and to health. People with a healthy, balanced supply of blood would likely be sanguine, having the healthy temperament and glowing complexion, which is the characteristic of a person dominated by this humor blood. It nowadays refers to as someone who is cheerful, confident, passionate and optimistic. The next humor is black bile. Excessive black bile or melancholy, which is characterized by sadness, gloom and moroseness. This might lead to depression and degenerative diseases or even cancer. Then comes yellow bile or choleric personality. This is characterized by irritable people who produce bitter, angry personality and are associated with feverish diseases. Finally, there is phlegm, which is said to be characterized of phlegmatic personality, that is sluggish, unemotional, cold, apathy, associated for example with rheumatism. Although notions of bodily humors have been discarded now, the underlying conception that individuals can be categorized as sanguine, depressed, hostile or repressed remains with us. It turns out that personality is indeed very relevant to understanding our health. With the dominance of psychoanalytic and neo-analytic theory in the emergence of field of psychiatry in the first half of 20th century, many interesting ideas in psychosomatic medicine grew out of psychodynamic framework. Alexander in the year 1950 suggested that various diseases are caused by specific unconscious emotional conflicts. For example, ulcers were linked to oral conflicts and unconscious desire to have basic infantile needs satisfied. And asthma is linked to separation anxiety, which is an unconscious desire to be protected by one's mother. Thus, although internal medicine exploded its influence on the medical science in the 1950s and 60s with pharmaceutical based on biochemistry, a substantial but underappreciated history in the medicine considered the importance of the psychology of the individual. However, like much psychoanalytic work, most of the early psychosomatic work could not be directly studied in a scientific manner and so was often ignored by those working in scientific fields. Now let us understand what is personality and why is personality important to health and disease. When we focus on individual's personality, it captures not only the individual's characteristic health relevant behaviors, his or her psychobiological predisposition, usual behaviors and emotional reactions, but also it captures the individual's perception of the social background and why some people are more likely to expose to infectious agents, why some people develop more unhealthy habits and why they enter stress inducing situations in the first place. The study of personality and health is especially significant because it leads directly to the issue of causal linkages. In other words, personality is of interest here because it allows better intervention to improve health, or at the very least it makes good prediction of future health and disease. By studying personality and health, or rather relationship between two, we are focused to gather research on genetics, development, psychoimmunology, stress and unhealthy habits and see how these pieces fit together in the whole person. Similarly, after examining social relations or socio-economic status or social integration, we are forced to return to study how these forces affect the individual. In the applied sphere, generally, the study of personality encourages a focus on individual differences in relation to interventions, and it cultivates attention to the individual selection of health relevant environment. That is, the personality, which is the individual's biopsychosocial patterns of behavior, is a construct that connects well with biopsychosocial approaches to health. Now coming to understanding the relation between personality and illness. Throughout life, aspects of personality may change, although usually very gradually they change. But personality captures a combination of genetic, experiential and socio-cultural elements, and so it provides a useful approach to a big picture. But because personality and health are affected by so many other internal, external and interactional variables, the causal links are multidimensional, meaning it cannot be understood only in one dimension. The personality is caused by behavioral root. The commonly investigated causal model which proposes that personality can lead directly to disease through patterns of unhealthy behaviors such as poor diet or lack of physical activity. A frequent and sensible step in examining links between personality and disease is thus to isolate and control the known behavioral causes of diseases such as avoiding smoking, drinking, etc. Broadly speaking, evidence supports that the idea of health relevant behavior can be an important mediator of some of the associations between personality and health. This is based on the research done by Bog and Roberts in 2004 and Cassel and Peronis in 2003. Personality does predict a wide variety of health relevant behaviors. For example, injury, violence and accident is a health outcome that is often strongly affected by personality and is influenced by health behaviors. This is especially true before middle age. Risky sports, unsafe driving and exposure to violent situations, including those that increase the risk of homicide and suicide, are the major threat to health and longevity. But usually the causes of injury are multifactorial. Then we talk about relation between personality and illness in the psychophysiological route. Personality can affect disease directly through physiological mechanisms. That is, individual reaction patterns can trigger unhealthy neurohormonal states. Model of personality causing disease through psychophysiological mediating mechanisms often begin with a focus on poor coping with stress. Depending upon the challenge, individuals who are depressed or introverted, repressed, unconscientious or otherwise unbalanced are often less successful in bringing to bear necessary psychological, social and behavioral resources to face challenge. Some individuals appear to employ mental efforts to improve their physiological functions in a much better way. Next, the relation between personality and illness can also depend on the selection of situations. This is the likely causal link between personality and disease, which involves gravitating towards or even choosing an unhealthy situations. The usual model of a person randomly encountering various stressful events is weak. The fact is that the individual helps, creates and selects events themselves. For example, the person who is high on neuroticism tends to predict to negative life events. That is, neurotic people are more likely to experience objectively more stressful events according to the research. Others who are very well socialized, conscientious and agreeable, which are traits of personality, are more likely to wind up well educated and are always surrounded by mature adults. It is not that personality leads directly to healthy behavior or unhealthy behavior, but rather personality facilitates entering the unhealthy situation. It depends on an individual how they are viewing the situation, how they are interpreting and how they are entering an unhealthy situation, which plays an important role in determining the illness and disease. The next topic here which we are going to discuss is basically about how specific traits are going to influence the health of an individual. A variety of research suggests that good mental health is always associated with good physical health. As noted, people who are well adjusted are at lower risk for serious conditions like heart disease than are those who are seriously or chronically hostile, depressed, anxious or unstable. It makes sense to examine specific personality traits and health because certain recognizable patterns of responding, when considered over for a long period of time, put one person at higher or lower risk of various chronic diseases and for premature mortality. This is especially true when personality is considered in conjunction with social, economic and physical environments. The big 5-factor model of personality, which I am going to talk about, will give you an insight about how specific traits are going to influence disease and illness. The 5-factor model of personality has the advantage over narrower personality traits in studying the relationship between individual differences and health. The 5-factor model includes broad personality traits such as extroversion, agreeableness, conscientiousness, neuroticism and openness. Extraversion encompasses more specific traits such as talkativeness, energy and assertiveness. Then next, agreeableness includes sympathy, kindness and affection. The third trait is conscientiousness, which includes organization, thoroughness and ability to make plans. Then comes neuroticism, which includes tension, moodiness and anxiety. Finally, there is openness, which consists of traits like having wide interests, being imaginative and insightful. Since each of 5-factor personality traits are considered as an adaptive set of traits, they are supposed to be related to health outcome. Research confirms that each of the 5 personality traits has an impact on various health related outcomes. The main mechanisms underlying their connection to health outcomes include their influence on health related behaviors, symptoms reporting, exposure and reactivity to stressful situations, seeking social support, etc. Now let us see how these specific traits are associated with our health. Coming to extraversion. People who are social and outgoing may have stronger immune systems. Extroverts' bodies tend to react more quickly to inflammation, which may help prevent infection. Another theory here is that extroverts, as they are more open and express their feeling in a better way, are more likely to put themselves in a stressful situations. So, their immune system basically is more engaged in protecting their bodies. Because extroverts express their feelings more easily, they may also be more willing to seek medical help when they need it. The second one is agreeableness. Agreeable people, as already said, are thoughtful, compassionate and also social. They are dedicated to resolving confrontations, which makes them happy and well adjusted. Agreeable people are also more accommodating. So, they may be more likely to follow their doctor orders, which is good for their health. However, they may also feel hopeless in difficult situations, especially health situations, and they may be less likely to get help when something is wrong because they feel they will be a burden to someone else. They may also let problems worsen rather than addressing them head on in order to avoid confrontation, which can lead to increased anxiety. Then comes conscientiousness. People who are conscientious are those who do things carefully, well and thoroughly. They tend to eat well, exercise well and are less likely to abuse substances such as smoking and alcoholism, and also generally they live longer. Conscientiousness people are high achieving, dependable and likely to be in a stable relationship, which basically improves their health. However, on contrary, conscientious people may be more susceptible to illness because some believe they have weaker immune systems which subconsciously become more cautious to protect themselves, and the personality trait can continue into adulthood also. Then we talk about the trait of neuroticism, which is widely researched. People who have neuroticism often experience anxiety, self-doubt, depression and shyness. All people who are neurotic to some degree, but those who have strong neuroticism may experience issues such as mood disorders, loneliness and self-consciousness. On the other hand, neurotic people are also good at planning ahead and are often successful at work. This may play an important role in planning their diets or exercise carefully so that they remain in good health. Then we talk about openness. Now, openness is often viewed as a positive trait. People who are open have high level of intrinsic motivation to pursue knowledge for its own sake. They are very curious about the world and want to learn more about how it works. They are also very eager to try new things, so they may be better able to adapt and thrive when faced with challenges in their environment, situation or relationship. This positive traits of open people helps them to maintain better health. They are also eager to try new things, so they may be better able to adapt and thrive when faced with changes in their environment, situation or relationship. This positive trait of open people helps them to maintain much better health than other people. However, because people who are high on this openness trait seek novelty, they may also be more willing to engage in a risky behavior. It includes adventurous trips, rash driving, etc. Thus, it can be concluded that traits are very important. Traits of personality play a very important role in determining what kind of health an individual has. Let us summarize what we have learnt in this lesson. We have seen that the relationships among individual differences, diseases and health have been investigated scientifically for more than 100 years now. It is believed that people who have negative qualities such as depression, boredom, who are frustrated, all such people will develop illnesses and die early than someone who is emotionally very stable who also has a satisfying job, and the one who is very stable in his community. The idea of relation between personality and health is dated back thousands of years, and it clearly appears in the writings of Greek philosophers and their followers. These theories state that there are 4 essentials of so-called bodily humors, which are very important to both individual and also to health. These 4 bodily humors are blood, black bile, yellow bile and phlegm. The main focus on the individual personality captures not only the individual's characteristic health relevant patterns, his or her psychobiological predispositions, usual behaviors and emotional reactions, but it also captures the individual's perception of the social background and why only some people are more likely to be exposed to certain infections, only why some people are developing unhealthy habit and are always in a stress inducing situations. The relation between personality and health can be understood through different routes such as behavioral route, psychophysiological route and selection into situation. There are also specific personality traits which lead to good physical health. For instance, people who are well adjusted are at lower risk of serious conditions like heart diseases than those who are seriously or chronically hostile, depressed, anxious or unstable. Finally, we have studied about the big 5-factor theory, which explains the relation between personality and illness in a more specific way. The 5 personality traits in this theory are extraversion, agreeableness, conscientiousness, neuroticism and openness. We have seen that each of these traits is associated with certain health behavior.